Good morning, Michelle. And unfortunately so. And I think the only thing surprising about this rage parties being a super spreader event is that it seems to be a surprise. It was completely predictable.
Yeah.
That these sort of events are going to lend itself to super spreader events. And when the minister talks about those individuals that attended the rage party needing to go into quarantine, in fact, it doesn't stop there. Because those individuals that are infected have already been actually spreading the virus to other people that they've been in close contact with. So the cat is out, the horse has bolted, essentially.
I mean, Prof, do you have any idea, because we're all as flabbergasted as I'm sure you are, that this event was ever allowed to even go ahead, that parents agreed to sending their children, that the event was allowed to happen. I mean, we've just recorded 4,000 new COVID-19 cases. That's been happening now for 4 consecutive days. Have you got any idea how it was allowed to happen?
Look, at the end of the day, it simply is a failure of government policy to have allowed these sort of events. And the same thing is going to continue throughout the vacation period. If government continues to allow gatherings in closed spaces with poor ventilation, you can be rest assured you're going to get massive number of infections take place. You can be rest assured that our hospitals are going to be full to capacity. These things are completely predictable. If there's one thing that's required in South Africa at this point in time, is to regulate against allowing mass gatherings of any sort. And unfortunately, that includes indoor dining in restaurants, in poorly ventilated areas. In the United States, evidence shows that 80% of all infections that are taking place are because of the so-called super spreader events, of people gathering in poorly ventilated indoor spaces.
Yeah, and just in terms of government allowing the event to go ahead, you know, we're building up to the festive season as well. You know, there's a lot of talk about COVID fatigue. People are just so desperate for a break. They're sick of wearing a mask wherever they go. You know, we've all got to just buck up and continue with what we need to do, Prof.
Correct. And it's not about not having fun during the vacation period. I agree, people need to have a break. But it's about responsible behavior. And engaging in indoor gatherings is irresponsible behavior, unfortunately, especially if it's in poorly ventilated areas, especially when it's being overcrowded. So yes, people need a break, myself included.
Yeah.
But at the end of the day, it's also about responsible behavior.
Yeah, absolutely. Prof, I want to talk to you while we have you on the line around the issue of vaccines that have been developed around the world. There's talk of America getting its first rounds of vaccines happening already on the 21st of December. But again, the vaccine is not going to be the answer to our problems. You know, as we on the continent now look to when we will be getting a vaccine here, how much of that vaccine we will be getting, even when that happens, it won't be the answer.
Unfortunately for South Africa and many other African countries, very much so. The reality is that we would be highly fortunate to get vaccine even sometime in the second quarter of next year. And the quantity of vaccine South Africa is likely able to access is going to be extremely limited. So it's hopefully will protect at least healthcare workers, some individuals with comorbidities, the elderly, but even only then, a percentage of them. So we're not out of the woods, and we're going to go through another winter period where we're going to see a lot of COVID illness being hospitalized, a lot of deaths from COVID-19. And again, it all unfortunately centers around the behavior of citizens. It's not about going back to level 3 and level 5 lockdowns. Those are not solutions to the problem. In fact, to some extent, they're actually exacerbating the problem of health in South Africa.
Yeah, I mean, Prof, you've got us all with our mouths open here in studio when you talk about us going through another winter period with COVID-19 being very much a part of our lives still. If we think about our frontline workers, for example, who already, you know, you talk about all of us needing a break now over the festive season period. Think about our frontline workers who have been at the forefront of fighting this pandemic for many, many months now, working 48-hour shifts. Some have told us they've not had a break. I mean, what is the plan from a policy perspective to get through the festive season and to do so without the kinds of things that we're seeing now with the Matric Rage Festival, to try and keep our numbers down, but to also prepare our infrastructure, and our frontline workers are very much a part of that, for another 6 months or more of COVID-19?
So, Michelle, unfortunately, it really comes to the issue of how government responds. Like I said, what we do know about this virus now, 10, 11 months into the pandemic, is that the major mode of transmission of this virus is airborne transmission, and especially in poorly ventilated areas. And if there's going to be any regulations to try to safeguard our healthcare facilities, to provide some level of relief to our healthcare workers, it's about regulating those sort of events that lends itself to many people being infected over a short period of time. That is what we don't want. That is what the wage parties are allowing for. That is what allowing for 50, even 60% occupancy in places of worship lends itself to. So it's really about trying to prevent this rapid transmission of the virus, which usually takes place when there is sort of crowded gatherings.
Yeah. Professor Madhi, you know, when we spoke to you in the first few months of the pandemic, there was a lot of talk around the kind of treatment protocols that were happening in hospitals, in hospital ICUs, how that treatment protocol was evolving. You know, every time we spoke to you, there was something new that was coming out of our treatment protocols. As you say now, months into it, heading into 2021, what are some of the new things, some of the developments that you're seeing in terms of treatment protocols for COVID-19?
So in terms of treatment protocols, we're in a much better space than we were in March of this year, in that we got a much better understanding in terms of how this virus causes a person to become ill, what are the major organs that are affected, as well as how to treat. So we don't have a treatment that provides 100% cure, but we do have treatments and low-cost treatments that are effective in terms of at least reducing the risk of dying when people are hospitalized. So as an example, things such as the use of steroids, rather than putting someone into a ventilator, putting them onto high flow oxygen. Those are things that are within the grasp of our healthcare systems to be able to provide. So healthcare workers are much better equipped in terms of providing care, but it only goes so far. Once healthcare facilities are overwhelmed, healthcare workers simply cannot continue providing the standard of care that's required to give a person that's got severe illness a chance of survival. So it's really safeguarding the healthcare systems by preventing this rapid spread of the virus.
Yeah, absolutely. And Prof, this issue around long COVID is becoming more and more of a talking point. Is that something that we are looking into seriously in terms of policies, in terms of, you know, how to support those who are suffering from this thing that's called long COVID? Long-term symptoms, be it neurological, be it in terms of, coordination, even walking. A lot of people reporting months later having so-called recovered from the virus, but still suffering from major illnesses.
Yeah, so unfortunately, it appears to be very much of a syndrome, which is of clinical relevance and is also of relevance to an individual. Things such as ongoing fatigue, ongoing shortness of breath, or even fogginess of the brain, just to name a few, seems to be something that's very real. So these are things that the healthcare systems, again, need to be providing some sort of level of support. But for many of these long COVID syndromes or symptoms, there isn't any specific treatment that can be given. It's really to give time for the body to actually recover because of the consequence of the illness that the person suffered.
Yeah. Professor, as always, a pleasure talking to you. Thanks so much for coming on to the show. Professor Shabir Madhi is a vaccinologist as we continue to unpack the story around these super spreader events, as the health department is now calling the Matric Rage events, the one happening in Belito, linked to a number of COVID-19 infections.